Hello everyone. Today, we're diving into the world of a medication called Jylamvo, which is the brand name for methotrexate oral solution. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Jylamvo, known generically as methotrexate oral solution, is a medication that belongs to a class of drugs called antimetabolites. Methotrexate interferes with the growth of certain cells in the body, particularly cells that reproduce quickly, such as cancer cells, bone marrow cells, and skin cells. It is commonly used in the treatment of certain types of cancer, including breast cancer, lung cancer, lymphoma, and leukemia. Additionally, methotrexate is prescribed for non-cancerous conditions like severe psoriasis and severe rheumatoid arthritis. It works by suppressing the immune system to reduce inflammation and slow the progression of disease. Methotrexate was initially approved by the FDA in 1953 and has since become a cornerstone treatment for various conditions. It is also used in the management of juvenile idiopathic arthritis in children. The versatility of methotrexate makes it an important medication in the field of both oncology and immunology. Warnings: methotrexate comes with a set of significant warnings and precautions. It can cause severe or life-threatening side effects, including damage to the liver, lungs, kidneys, bone marrow, and gastrointestinal tract. Because of its potential toxicity, methotrexate is generally prescribed only after other treatments have failed or when the benefits outweigh the risks. Methotrexate is not recommended for pregnant women or women planning to become pregnant, as it can cause birth defects or fetal death. It is also not recommended for breastfeeding mothers due to potential harm to the infant. Regular monitoring through blood tests and medical evaluations is essential to detect any adverse effects early. Before taking this medicine. Before starting Jylamvo, methotrexate, it is crucial to discuss your medical history with your healthcare provider. Inform your doctor if you have any of the following conditions: liver disease or alcoholism, kidney disease, lung disease or breathing problems, blood cell disorders, such as anemia, leukopenia, or thrombocytopenia, stomach ulcers or other gastrointestinal problems, immunodeficiency conditions. Additionally, inform your healthcare provider about all medications, supplements, and herbal products you are currently taking to avoid any adverse interactions. Side effects: all medications can have side effects, and methotrexate is no exception. Common side effects include nausea, vomiting, and stomach pain, diarrhea, mouth sores, hair loss, rash or itching. Serious side effects may include liver damage, indicated by symptoms such as yellowing of the skin or eyes, jaundice, dark urine, or persistent nausea. Lung problems, such as shortness of breath or a persistent cough. Severe skin reactions. Low blood cell counts, leading to increased risk of infections, unusual bruising or bleeding, and extreme fatigue. Kidney problems, indicated by changes in urine output or swelling in the lower limbs. If you experience any severe or unusual symptoms, it is crucial to seek medical attention immediately. Interactions: methotrexate can interact with various medications, increasing the risk of side effects or reducing its effectiveness. Inform your doctor about all medications you are taking, especially nonsteroidal anti-inflammatory drugs, NSAIDs, antibiotics, anti-epileptic drugs, vaccines, other immunosuppressive drugs. Dosage: the correct dosage of methotrexate is vital for its effectiveness and safety. The dosage will vary depending on the condition being treated, the patient's response to the medication, and other factors. Methotrexate is typically taken once a week for rheumatoid arthritis and psoriasis, but the dosage may be different for cancer treatment. Always adhere to your doctor's recommendations and do not alter your dosage without consulting your healthcare provider. Regular monitoring and periodic checkups are necessary to ensure the drug's efficacy and safety. Avoid. While taking Jylamvo, it's important to avoid alcohol as it can increase the risk of liver damage. Additionally, avoid prolonged sun exposure and use sun protection, as methotrexate can make your skin more sensitive to sunlight. It's also recommended to avoid live vaccines, as methotrexate can weaken your immune system, making you more susceptible to infections. FAQ: what is the primary use of Jylamvo? Jylamvo, methotrexate oral solution, is primarily used to treat certain types of cancer, severe psoriasis, and severe rheumatoid arthritis. It helps in slowing the growth of cancer cells and reducing inflammation in non-cancerous conditions. Can Jylamvo be used in children? Yes, Jylamvo is used in the treatment of juvenile idiopathic arthritis in children. However, the dosage and administration should be carefully monitored by a healthcare provider. What should I do if I miss a dose? If you miss a dose of methotrexate, take it as soon as you remember. However, if it is almost time for your next scheduled dose, skip the missed dose. Do not take extra medicine to make up for the missed dose. Always consult your doctor for guidance. How should I store Jylamvo? Store Jylamvo at room temperature, away from moisture and heat. Keep the bottle tightly closed when not in use. Dispose of any unused medication safely, according to your healthcare provider's instructions. Closing. That wraps up our overview of Jylamvo, methotrexate oral solution. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.